Queensland, we have 6 new cases today. We have 2 that are overseas acquired and detected in hotel quarantine, and we have 4 local community cases. So I just want to give a brief overview, but as I said, there'll be more details coming at 10:30. And as you can appreciate, we've been getting these briefings right through this morning, so the most up-to-date information will be with you at 10:30. So the first person is a fully vaccinated gentleman who works in an aviation training facility. He was infectious in the community for 3 days, and he was double dose vaccinated, but he only had that second dose, I understand, about a week ago. Now, he's from Eatons Hill. The second case is his wife, and the third case, which Dr. Young is a little bit more concerned about, is a truck driver who was living in shared accommodation but has been infectious in the community for around a week. So she'll be going into more details there, and can I say too that the police are speaking to this truck driver to get some more information from him. And this fourth case, which Dr. Young is not too concerned about, is a person who completed their full 14 days hotel quarantine, but then tested positive after leaving hotel quarantine. So she'll go into those details. So we've had 9,328 tests in the past 24 hours. 18,482 vaccines were delivered by Queensland Health yesterday. So we now have 64.1% of eligible Queenslanders who've had their first dose, and 45.13% are fully vaccinated. So again, that's really good news. So just in relation to these issues that we're seeing at the moment. So there's no need to panic because Queenslanders have been doing the right thing, especially in the southeast. But what Dr. Young has said that what we will be doing, and she'll give more details, is that we want to go back to people wearing their masks indoors if you live in the Brisbane area and the Moreton Bay region. So if you're outdoors, you don't need to socially distance, and she'll be putting some restrictions on like aged care facilities, disability settings and corrective services. So look, everyone, can I just say, we've been here before. I know that Southeast Queenslanders will rise to this challenge once again. It is so important for people to use that check-in app. And as I said, until we get to that, 80% fully vaccinated, these masks are indeed our best line of defence. So please, Queensland, please make sure that you are continuing to use these masks, especially in the Brisbane and Moreton Bay region. So of course, also, if you have any symptoms whatsoever, it is absolutely imperative that you get tested. So please come forward and get tested if you have any symptoms. Now, the second issue that Minister Bailey and I want to speak to you about, and Minister Bailey and the Health Minister have been working on this, and this is in relation to truck drivers. As we've seen, we've had 7 truck drivers who've entered Queensland who've been infectious in the community since the 24th of August. So from the 15th of October, it'll be mandatory for all truckies that are using the freight pass to have 1 dose. By the 15th of November, they'll need to have their second dose or a booking. And from today, we are starting roadside vaccinations for truckies. There's going to be a special clinic that will be set up at the John Flynn Hospital, Boyd Street, Tugun. So I'll get Minister Bailey to go into more details about that. And finally, Sunshine Coast residents, can I say thank you for coming out and getting vaccinated. We now have vaccination hubs at Sunshine Coast University Hospital and Nambour Hospital. And from October the 11th, the Cloundra Indoor Stadium will also come online as a vaccination centre. And to date, the Sunshine Coast HHS has done 150,602 vaccines. So that's absolutely fantastic. And of course, we want to make sure that as many residents as possible on the Sunshine Coast are getting their vaccines. So look, I'll get Minister Bailey just to talk about the truck drivers a little bit more in detail. We're happy to take some questions, preliminary questions about these COVID cases, remembering that Dr. Young and the Health Minister will go into much more detail at 10:30.